Are you ever curious about the ways in which you might improve the health of your kidneys through natural means? If this is the case, you have arrived at the correct spot, because we are going to discuss with you today the 6 natural beverages that are the most beneficial to the health of your kidneys. What can you do to assist these busy organs and guarantee that they continue to be in outstanding condition? Our kidneys play a crucial role in the process of filtering out hazardous chemicals from our bodies. However, what can you do to ensure that they continue to provide support? You can find the solution in the beverages that you decide to consume daily. A significant number of us are appropriately hydrated. Nevertheless, the challenge is in the sources from which we obtain our hydration. Soda, sweet tea, and juice are examples of liquids that are laden with sweets that are not immediately noticeable. We frequently choose these kinds of beverages. These decisions have the potential to raise our chance of developing kidney disease, which is one of the primary causes of the condition. Other risk factors include diabetes, high blood pressure, and obesity. In light of this, what are some ways that we might substitute these sugary beverages with alternatives that are better for our kidneys and are healthier? The question that we are going to answer today is the one that you provided. However, that is not all. In this video, we will not only introduce you to these delicious beverages, but we will also go into the science that behind the benefits that they give. You will get an awareness of how they can be advantageous to the health of your kidneys, and more significantly, how you can effortlessly include them into your day-to-day routine. You are going to be astounded by the extent to which these can be beneficial to your kidneys. Health can improve just by adding these drinks to your daily diet. So without further ado, let's get started. Number 1, black coffee. If you love coffee, you'll be happy to know that it is very good for your kidneys too. According to some studies, drinking black coffee regularly can reduce the risk of kidney stones and acute kidney injury. One study published in the American Journal of Kidney Diseases used genetic data of hundreds of thousands of people and found that increasing coffee intake from 1 cup a day to 1.5 cups per day reduces the risk of kidney stones by 40%, according to the findings of yet another study conducted by researchers from Johns Hopkins Medicine. Individuals who consume at least 1 cup of coffee daily had a 15% lower risk of experiencing acute renal injury. The study hypothesized that coffee and caffeine may enhance blood flow and oxygen consumption within the kidneys, so protecting them from injury and disease. This is due to the fact that coffee contains antioxidants and caffeine, both of which have anti-inflammatory and diuretic properties. Caffeine, which is found in coffee, is responsible for this action because it suppresses inflammation and stimulates the production of urine. There are, however, some coffee beverages that are not good for you, and if you have renal illness, you should restrict the amount of things that you put in your coffee. Instead of drinking milk or sugary drinks that are high in calories, you should drink black coffee. This is because black coffee is less likely to contain high levels of potassium and phosphorus than other types of coffee. Drinking black coffee in moderation and paying attention to how your body reacts to it is something you should do, just like you would with anything else. If a person consumes an excessive amount of coffee, they may be more likely to acquire renal dysfunction because they have a genetic variant that causes them to metabolize caffeine at a slower rate. This may increase the likelihood that they may develop renal dysfunction. It is strongly suggested that you consult with your primary care physician prior to increasing the amount of coffee that you consume. One of the most important roles that these antioxidants play is in reducing oxidative stress, which is a situation that can have a negative influence on the kidneys. Because of the continuous filtration and waste removal operations that they do. For further information, green tea, which is highly regarded for the abundance of polyphenols it contains a wide variety of powerful antioxidants, one of which is catechin. It is probable that the capacity of green tea to neutralize harmful free radicals can play a substantial part in lessening this oxidative burden, which offers significant benefits for kidney health. Green tea consumption has been shown to have a positive impact on kidney health, There have been a great number of studies conducted to examine the connection between consuming green tea and kidney health. Several significant aspects have been highlighted as a result of these studies. In the first place, green tea is highly effective in regulating blood pressure due to its high caicin content, which shows great promise for protection. There is a well-established link between high blood pressure and kidney disease, and the anti-hypertensive properties of green tea have the potential to reduce the likelihood of developing kidney disease. Furthermore, the anti-inflammatory properties of green tea are of significant importance due to their large relevance. It is recommended to consume green tea if you suffer from kidney disease. Green tea's ability to suppress inflammatory pathways plays a key role in lowering the risk of kidney damage. Chronic inflammation can cause kidney damage, and green tea components that inhibit these pathways can reduce the risk of kidney damage. Additionally, the antioxidative defenses provided by polyphenols in green tea are advantageous. These antioxidants, of utmost importance, serve as protective shields for renal cells, reducing damage caused by oxidative stress. Therefore, drinking green tea can be regarded as a therapy for preserving renal function and slowing the progression of kidney diseases. Green tea is typically consumed in the morning. Moreover, the potential of green tea in diabetes management is significant and should not be overlooked. Green tea can increase insulin sensitivity and manage glucose levels, reducing the risk of diabetic nephropathy, a kidney condition associated with diabetes. Kidney disease is more likely in those with type 2 diabetes. Finally, the antifibrotic properties found in animal studies using green tea components show positive results. These results were clearly demonstrated. Kidney fibrosis often appears in chronic kidney disease, and green tea's anti-fibrotic effects offer therapeutic avenues to slow or prevent fibrosis progression in the kidneys. Would you like to know the best green tea brewing method? First, remember to use high-quality loose-leaf green tea, not tea bags, to maximize benefits. This ensures you use the whole tea leaves, which are of great value. After pouring water that is not boiling over the tea leaves and allowing it to steep for approximately 10 seconds, discard this water to remove some of the initial tea components, eliminate any stimulating substances, and ensure that the flavor of green tea is unadulterated. After that, pour hot water that is not boiling over the tea leaves, and then let the tea steep for 1 to 2 minutes. This process allows the tea leaves to fully open up and release the essence of green tea, enabling you to enjoy all the nutritional benefits green tea has to offer. Even if you can only use green tea bags, you can still gain the benefits green tea provides for kidney health. The beverage known as cranberry juice ranks third. Cranberry juice is an exceptional beverage with numerous benefits for kidney health. Its rich antioxidant content, particularly proanthocyanidins, equips it with anti-inflammatory properties, making it a valuable ally against chronic inflammation, a factor contributing to kidney damage and dysfunction. A study published in the Journal of Nutrition in 2013 confirmed these effects, showing that cranberry juice consumption reduced markers of inflammation in subjects with chronic kidney disease. Additionally, cranberry juice has long been valued for its ability to prevent urinary tract infections, UTIs. Proanthocyanidins in cranberries act as a shield, preventing bacteria from adhering to the urinary tract lining, thus reducing the likelihood of UTIs. Cranberry products, especially cranberry juice, effectively reduce UTI occurrences, benefiting the entire kidney health spectrum. Cranberry juice is even more effective than other cranberry products. Furthermore, cranberry juice provides significant protection against the harmful effects of free radicals. Recent research published in the American Journal of Clinical Nutrition in 2016 provided evidence supporting this notion. Oxidative stress, a factor in renal diseases, has the potential to have a devastating effect on kidney cells and to bring about difficulties. According to a comprehensive study published in the journal Advances in Nutrition in 2019, cranberry polyphenol has been demonstrated to have the ability to lessen the effects of oxidative stress and to improve kidney function. For individuals at risk of developing renal illness due to high blood pressure, the benefits of cranberry juice are not limited to these areas. Cranberry juice can also be beneficial in other aspects. There is a possibility that consuming cranberry juice could be of assistance. Cranberry juice may play a role in moderately decreasing blood pressure, according to research published in the Journal of Nutrition in 2015. These studies were conducted in 2015. Kidney health is significantly improved as a result, especially for people who suffer from hypertension. Additionally, cranberry juice has the potential to aid in preventing the formation of specific kidney stones, such as the calcium oxalate commonly found in kidney stones. Cranberry juice contains compounds that have the impressive capacity to inhibit the crystallization of calcium oxalate in urine, potentially reducing the likelihood of stone formation. Cranberry juice is also a good source of calcium oxalate inhibitors. Lemon juice. Lemon juice is especially well known for its high citrate concentration, which is a primary reason for its popularity. Lemon juice contains a substantial amount of citrate, a chemical that plays a key role in preventing the formation of kidney stones, particularly calcium oxalate stones. This occurs because citrate binds to calcium ions in the urine, reducing the amount of calcium available for stone formation. A study conducted in 2007 and published in the Journal of Urology provided evidence of this effect. After being absorbed by the body, lemon juice has an alkalizing effect, despite its taste being similar to that of orange juice. For the purpose of maintaining an appropriate pH level in the urinary system, this alkalization is extremely important. Several studies, including one published in the British Journal of Urology International in 2009, have demonstrated that lemon juice can increase urine pH levels and lower the incidence of certain kidney stones, such as uric acid stones. Additionally, lemon juice offers significant antioxidant properties, primarily due to its high vitamin C content. This is the case because lemon juice includes large amounts of vitamin C. When it comes to the fight against oxidative stress, which can lead to kidney cells becoming damaged over time, antioxidants are incredibly helpful. The potential of vitamin C in lemon juice to minimize the effects of oxidative stress was highlighted in a study published in the journal Free Radical Biology and Medicine in 2005. This study was conducted in addition to the antioxidant benefits that lemon juice offers. Lemon juice has the potential to operate as a mild diuretic, which encourages increased urine production, provided that it is consumed in moderation rather than in large quantities. Additionally, appropriate hydration and mild diuretic effects contribute to the elimination of waste products and the reduction of fluid retention. Persistent inflammation is also a significant threat to kidney health. In addition to containing compounds like flavonoids, which have anti-inflammatory properties, lemon juice contains other beneficial substances. It is likely that these potential anti-inflammatory properties help protect renal tissues from damage caused by prolonged inflammation. Starting your day with a simple mixture of 1 tablespoon of apple cider vinegar, 2 teaspoons of pure lemon juice, and 500 milliliters of water is recommended. This should be done on an empty stomach. Vitamin C, acetic acid, and citric acid are all components of this cocktail and can help cleanse the kidneys effectively. Acetic acid comes from apple cider vinegar, citric acid from lemon juice, and vitamin C from lemon juice as well. Beetroot juice is well known for its incredible amount of nitrates, essential for kidney health. Nitrates, once consumed, convert to nitric oxide in the body. A vasodilator, nitric oxide relaxes blood vessels, lowering cholesterol levels and blood pressure. Notably, a study published in Hypertension Journal in 2008 found that dietary nitrate supplementation, similar to beet juice intake, significantly reduced blood pressure. Furthermore, beets are a rich source of antioxidants, including vitamin C and betalains. These antioxidants play an important role in combating oxidative stress and inflammation, both of which are closely related to kidney health. Scientific investigations, such as one described in the Journal of Agricultural and Food Chemistry in 2001, highlight the powerful antioxidant capacity of beetroot extracts. In addition to their antioxidant properties, Beets positively impact kidney stone prevention. Beetroot extract has been shown to reduce calcium oxalate crystal formation, a major component of kidney stones. However, incorporating beetroot juice into your diet should be done in moderation, especially if you have pre-existing kidney issues. Excessive nitrate intake may significantly impair renal function, as observed in various studies. Water, though it may seem self-evident, is the healthiest beverage for your kidneys. Often called the elixir of life, water not only relieves thirst, but plays a crucial role in maintaining kidney health. When waste products are dissolved in water, kidneys can expel them through urine more efficiently. Water acts as a magical solvent, facilitating the dissolution of waste products. Consuming adequate water ensures uninterrupted filtration, reducing toxin accumulation that could harm kidney function. Water functions as a natural deterrent against this widespread and frequently excruciating ailment, as it dilutes the components that lead to the creation of stones. Stones are a common condition that can be extremely painful. Maintaining a healthy level of hydration has been shown to contribute significantly to the regulation of blood pressure, keeping it within a reasonable range. The consumption of water helps blood vessels to relax, which in turn reduces the workload on the heart and indirectly supports kidney health. Hydration is crucial for maintaining the delicate balance of electrolytes, ensuring that kidneys effectively regulate these essential substances in the blood. This balance is essential for the optimal functioning of nerves, muscles, and of course, the kidneys. Adequate water intake serves as a natural defense against urinary tract infections. It dilutes and flushes out bacteria that might find their way into the urinary tract, thus reducing the risk of infection. By maintaining a well-hydrated urinary system, you create an environment that is far less conducive to the proliferation of harmful microbes. It is a common question to ask how much water is sufficient, and the well-known 8-8-8 rule, which states that one should drink 8 glasses of water each day, serves as a practical guideline. Following this rule not only supports kidney health, but also aids in other bodily processes, such as regulating temperature, lubricating joints, and assisting with digestion. However, remember that individual needs may vary. It is possible to gain significant insights about your hydration level by paying close attention to the signals your body sends, such as feelings of thirst, or by observing the color of your urine. A light or pale yellow color typically indicates adequate hydration, while darker shades can suggest a need for more water. Listening to your body in this way can prevent dehydration, which may lead to fatigue, dizziness, and other health issues. There are a variety of factors that influence an individual's hydration requirements, including age, weight, level of physical activity, and the climate in which they live. Hotter environments or increased physical exertion, for example, demand higher water intake to replenish lost fluids, ensuring that the body functions optimally. Similarly, older adults might need to pay more attention to hydration due to age-related bodily changes. Depending on these criteria, the amount of water your body requires will be determined. And while 8 glasses may work for many, adjustments are often necessary. For instance, people who consume high-salt diets may require more fluids, as salt can increase the body's demand for water. Should you find this material helpful, you might consider sharing it with the people you care about and those in your wider circle. Spreading awareness on hydration and its significance can benefit those around you, especially as dehydration is often overlooked as a cause of certain health issues. Taking proactive steps to encourage hydration habits can make a real difference in the well-being of loved ones. Additionally, do not forget to subscribe to our channel to receive more illuminating and powerful ideas about health and well-being. Our channel covers a range of topics beyond hydration, including tips on balanced nutrition, physical activity, mental health, and more. Staying informed and adopting small, positive changes in lifestyle can profoundly impact your overall quality of life. We are extremely appreciative of your support, and until we meet again, we ask that you take care of both your kidneys and each other. Remember, every small effort you make to improve your health adds to a cumulative positive effect on your body, mind, and spirit. Could a seemingly harmless vitamin supplement, consumed daily by countless individuals, turn out to be a hidden peril? Imagine the shock and dismay of discovering that a routine health decision, taking a vitamin you believed was completely safe, could result in a life-threatening situation. This chilling scenario became a reality for a 55-year-old woman whose alarming experience serves as a cautionary tale. In today's discussion, we will delve into her harrowing ordeal to uncover what went wrong and how similar dangers can be averted. In the chilly month of December 2012, a 55-year-old woman found herself in a dire situation that led to her being urgently transported to the emergency department. She had been managing kidney disease for some time, but on this particular day, her symptoms had escalated alarmingly. She presented with severe weakness, a markedly slow heartbeat, significant bodily swelling, and hypothermia, with her body temperature plummeting to a perilous 93 degrees Fahrenheit, far below the normal body temperature of 98.6 degrees Fahrenheit. This stark drop in temperature was a critical indicator that her bodily functions were severely compromised, pointing to an acute exacerbation of her underlying condition. As medical professionals scrambled to stabilize her, the question arose, what could have caused such a sudden and severe downturn in her health? The answer lay in the daily vitamin supplement she had been taking, assumed to be a safe and benign boost to her health. However, as the investigation into her condition deepened, it became evident that this common supplement was in fact exacerbating her kidney disease, leading to life-threatening complications. Join us as we explore the details of her medical emergency, the investigations that followed, and the lessons that can be learned from her experience. We aim to provide valuable insights into how everyday health decisions can have profound implications and what steps can be taken to ensure safety when choosing and using dietary supplements. Upon recognizing her severe symptoms, the hospital's medical team acted swiftly to evaluate the function of her kidneys, as evidenced by her creatinine levels, a critical indicator of kidney health. Creatinine is a waste byproduct that is typically filtered out of the blood by the kidneys. Elevated levels of this substance in the blood suggest that the kidneys are not performing their essential filtering function effectively. In her case, the test results were not just elevated, but alarmingly high. Her serum creatinine levels had surged to 3,530 milligrams per deciliter, mg, ddl, a significant increase from her previously recorded levels just 2 months prior. This indicated a rapid and severe decline in kidney function. Her body had even ceased urine production, a condition known as anuria, which is a clear sign of acute kidney failure. Given the gravity of her condition, the decision was made to transfer her immediately to the intensive care unit, ICU. The urgency of her situation necessitated the immediate commencement of dialysis treatment. Dialysis is a critical medical intervention that simulates kidney function by filtering and purifying the blood through a machine, effectively removing toxins and excess fluids from the body when the kidneys are unable to do so. The medical team was baffled by the swift decline in her kidney function and undertook a comprehensive series of tests in an effort to identify the underlying cause. After an exhaustive investigation, they pinpointed the source of her acute kidney injury, a common vitamin supplement frequently used by many as a routine health maintenance strategy. This ordinary supplement, perceived by most to be harmless, had in fact inflicted severe damage on her already vulnerable kidneys. This incident underscores a crucial lesson. The potential risks associated with taking supplements are not limited to prescription medications alone. Over-the-counter vitamins, often presumed safe by the general public, can pose serious health threats. The distressing experience of this woman acts as a profound cautionary tale, emphasizing the importance of approaching all supplements with skepticism and caution. Vitamins are essential for health, but they can also pose serious risks if not used correctly, particularly for individuals with kidney disease. Kidney disease compromises the body's ability to filter and eliminate waste, including excess vitamins, which can accumulate to toxic levels. Today, I will discuss 5 vitamins that can be especially hazardous for those with kidney conditions if not managed properly. It's essential to strike a balance, while avoiding all vitamin supplements can negatively affect kidney health. Being overly liberal or careless with their use can lead to severe complications. The broader landscape of health incidents related to improper vitamin use includes several cautionary tales. For instance, a TikTok influencer recently developed kidney stones attributed to an excessive intake of vitamins intended to enhance her immune system. In another case, earlier this year, a 61-year-old man experienced intense abdominal pain, initially suspected to be pancreatitis, but later linked to his use of vitamin supplements. Additionally, a disturbing report involved a patient who endured constant vomiting, severe leg cramps, and a dramatic weight loss of 28 pounds within a month due to excessive vitamin consumption, ultimately resulting in severe kidney damage. These examples highlight the critical need for informed decisions when it comes to supplement use. Patients with kidney disease must be particularly careful, as their condition hinders the elimination of excess vitamins, increasing the risk of toxicity. By being well informed about the specific vitamins, understanding the proper dosages, and recognizing the associated risks, individuals can better manage their health and avoid putting additional strain on their kidneys. In today's discussion, we will explore 5 specific vitamins known for their potential risks when not used appropriately, particularly in those with kidney disease. These vitamins, if taken in incorrect dosages or forms, can exacerbate kidney problems or lead to other serious health issues. It is vital for anyone, especially those with compromised kidney function, to approach these vitamins with caution and always consult healthcare professionals before starting any new supplement regimen. Vitamin number 3. As we continue our discussion on vitamins that pose potential risks, especially to those with kidney disease, number 3 on our list is alpha tocopherol, the synthetic form of vitamin E. This widely used vitamin has been linked through various studies to several adverse health effects. Notably, research has shown that alpha tocopherol can lead to significantly increased blood pressure and may elevate the risk of stroke and cancer. Further studies suggest it could contribute to bone loss, heightened cholesterol levels, and even kidney damage among the general populace. Alpha tocopherol's ubiquitous presence in the market makes it difficult to avoid. It is frequently added to a myriad of products ranging from dietary supplements to nutrient-enriched powders, beverages, and fortified foods. For individuals with kidney disease, the risks associated with synthetic vitamin E are particularly pronounced, which is why I consistently advise against supplementing with this form of vitamin E if you suffer from such conditions. Despite the potential hazards of synthetic vitamin E, the natural form of vitamin E might offer benefits. Known as a powerful antioxidant, natural vitamin E is increasingly recognized for its importance in the management and treatment of kidney disease. However, due to the concerns surrounding synthetic variants, it is essential to approach supplementation with caution. I strongly recommend against using any form of vitamin E supplements unless explicitly prescribed by your healthcare provider, with a particular emphasis on avoiding synthetic forms. For those aiming to include vitamin E in their diet safely, focusing on food sources is the best approach. Foods such as sunflower seeds are incredibly rich in natural vitamin E. In fact, just 1 ounce of sunflower seeds can provide about 66% of your daily vitamin E requirement, making them an excellent addition to a healthful diet. In summary, while natural vitamin E can be advantageous due to its antioxidant properties, the synthetic variant, alpha tocopherol, poses significant risks and should be avoided. Be particularly wary of any supplement that contains high doses of synthetic vitamin E. Always consult with a healthcare professional before incorporating any form of vitamin E into your health regimen, especially if you have pre-existing conditions like kidney disease. This careful approach ensures you harness the benefits of natural vitamin E while steering clear of the potential dangers associated with its synthetic counterpart. Vitamin number 2, securing the second spot on our list of vitamins with potential dangers, particularly for those with kidney health concerns, is vitamin A. This essential nutrient, typically beneficial for health, poses significant risks when consumed in excess, especially for individuals with chronic kidney disease, CKD. Vitamin A is a fat-soluble vitamin, which means it has the capacity to accumulate in the body's fat stores and reach toxic levels if intake is too high. Overconsumption can lead to a condition known as hypervitaminosis A, characterized by a range of symptoms, including nausea, dizziness, and headaches. More severe consequences of vitamin A toxicity can include liver damage, increased intracranial pressure, and bone thinning. The risks are particularly heightened in individuals with CKD, as their impaired kidney function hampers the ability to effectively filter and eliminate excess vitamin A. For individuals with compromised kidney function, it is generally recommended to avoid regular multivitamins that contain vitamin A. Products from popular brands like Centrum, Smarty Pants, or Superdin, well known in Europe, could potentially exacerbate health issues if they lead to an accumulation of vitamin A. This is due to the fact that damaged kidneys are less capable of filtering out this vitamin efficiently, allowing it to build up to toxic levels, potentially causing severe health complications such as liver damage, birth defects, and accelerated kidney deterioration. Moreover, vitamin A toxicity is not only a concern with supplements, but also with dietary sources. High intake of certain foods rich in vitamin A, such as fish liver, has been known to cause acute kidney injury, though such incidents are relatively rare. This emphasizes the need for caution, as even natural sources of vitamin A can pose significant health risks when consumed in large amounts. Additionally, the levels of vitamin A typically found in over-the-counter multivitamins can be unsafe for individuals with reduced glomerular filtration rate, GFR, a common issue among CKD patients. Due to the potential for accumulation, managing vitamin A intake is crucial to prevent toxicity and further kidney damage. In conclusion, while vitamin A is an essential nutrient necessary for various bodily functions, its intake must be carefully monitored, particularly in individuals with existing kidney conditions. Ensuring a balanced intake, preferably from dietary sources and under medical guidance, can help mitigate the risks associated with this fat-soluble vitamin. Vitamin number 1. Taking the top spot on our list is vitamin C, renowned for its essential health benefits, but also capable of causing severe health complications when taken inappropriately. The story of a 55-year-old woman who suffered catastrophic kidney damage brings critical attention to the potential dangers associated with this commonly consumed supplement. In her daily regimen, the woman included various supplements such as calcium, digestive enzymes, cranberry, a multivitamin, vitamin D, and notably, vitamin C. Each supplement was part of her strategy to maintain and enhance her health. However, it was the vitamin C that played a pivotal role in her rapid and severe health decline. Medical professionals initially struggled to determine the cause of the rapid deterioration in her kidney function. The turning point in understanding her condition came with the results of a detailed kidney biopsy. The biopsy revealed extensive accumulation of oxalate crystals in her kidneys, a serious condition that can be directly linked to excessive intake of vitamin C. Vitamin C, or ascorbic acid, is often recommended in daily doses of about 1,000 milligrams to boost immunity and prevent vitamin deficiencies. While these doses are generally safe for healthy individuals, they can be dangerously high for those with underlying kidney conditions. In the case of the 55-year-old woman, her intake of 1,000 milligrams of ascorbic acid daily turned out to be a critical mistake given her compromised kidney function. Excessive consumption of vitamin C can lead to the production of large quantities of oxalate, a substance that is normally filtered by the kidneys and eliminated in urine. However, in patients with reduced kidney function, the ability to process and eliminate oxalate effectively is diminished. This can lead to the formation and accumulation of oxalate crystals, which can cause significant kidney damage and other serious health issues. This example underscores the importance of moderation and caution when taking supplements, particularly for individuals with pre-existing health conditions such as chronic kidney disease. It highlights the need for consulting healthcare providers before starting any new supplement regimen and stresses the potential risks of taking even commonly recommended vitamins, like vitamin C, without proper medical oversight. Vitamin C is widely recognized for its beneficial effects, including its antioxidant capabilities, boosting the immune system, and enhancing iron absorption. However, as illustrated by the severe case of the 55-year-old woman, high dosages of this vitamin can become detrimental, particularly when the body's ability to process and eliminate the excess is compromised. This tragic incident provides a critical health lesson on the necessity of moderating vitamin intake, especially for those with pre-existing health conditions or impaired organ functions. In her scenario, the excessive intake of vitamin C led to the formation of oxalate crystals, a condition that, in healthier individuals, could potentially result in the development of kidney stones. For those already struggling with kidney issues, such as the woman in this case, the outcome can be far more severe, escalating to acute kidney failure. Moreover, this story emphasizes the crucial role of medical oversight in the use of supplements, particularly for individuals with chronic illnesses or significant health issues. Patients with conditions like kidney disease must consult healthcare providers before beginning or continuing any supplement regimen. This consultation ensures that their intake is appropriately tailored to their body's specific needs and limitations, minimizing the risk of adverse effects. It is vital for individuals to stay vigilant and be aware of symptoms that might indicate problems associated with high vitamin intake. Symptoms such as changes in urine output, sudden swelling, fatigue, and alterations in heart rate are all indicators that something may be amiss. Recognizing these signs early and consulting with healthcare professionals can prevent the progression of potentially severe health issues. The case of the 55-year-old woman serves as a poignant reminder of the delicate balance required in supplement consumption and the potential risks of overlooking this balance, especially in vulnerable populations. As such, it underscores the broader lesson of approaching vitamin supplementation with caution, informed knowledge, and medical guidance to safeguard against unintended health consequences. Recognizing the signs of vitamin toxicity early can lead to timely medical intervention, potentially preventing severe and irreversible damage. While vitamins are essential for maintaining good health, their consumption needs to be approached with caution and responsibility, especially among those with existing health vulnerabilities. The case of the 55-year-old woman serves as a sobering reminder of the risks associated with indiscriminate supplement intake and underscores the importance of informed and cautious use. This discussion emphasizes why vitamin C has been placed at the top of our list for its potential dangers. It might seem surprising that a daily dose of 1,000 milligrams of vitamin C, often perceived as not unusually large, could lead to catastrophic kidney damage. Yet, this exact scenario unfolded for a patient with chronic kidney disease, highlighting the critical need for caution and moderation in vitamin supplementation. Many manufacturers recommend this 1,000 milligram dosage, often implying that it is both safe and necessary for boosting health. However, as this case illustrates, the reality can be starkly different and demands a thorough examination of common supplement practices. This dosage, promoted by numerous brands, led to severe kidney damage in the patient discussed, reflecting a broader issue across the supplement industry where similar dosages are frequently recommended. The assumption that vitamin C is harmless is a misconception that this story helps to correct. The narrative serves as a stark reminder that more isn't always better. While a small amount of vitamin C can be beneficial, excessive intake can pose serious health risks, particularly for individuals with kidney issues. Those considering or currently taking vitamin C supplements should critically evaluate their dosage. While 100 milligrams per day may be sufficient for general health, Increasing the dose to 1,000 milligrams could be harmful, especially for those with compromised kidney function. It's crucial for individuals to ensure their vitamin intake remains within a safe threshold and to regularly consult healthcare professionals to tailor their supplement use according to their specific health conditions. If you're keen on learning how to supplement with vitamin C safely, particularly if you're concerned about kidney health, make sure to follow our channel. We're dedicated to guiding you through the safe practices of vitamin supplementation, with a special focus on situations where kidney health could be compromised. Vitamin C, or ascorbic acid, is a water-soluble nutrient and is usually excreted through the urine when consumed in reasonable amounts. However, taking vitamin C in higher doses can lead to its crystallization, which might not be adequately excreted. Such crystallization can result in the formation of oxalate crystals that accumulate in the kidneys and cause significant damage. It's essential to understand the risks associated with high doses of vitamin C, especially for individuals with kidney disease, to protect your health effectively. Being well-informed and cautious about your supplement use can help you make safer decisions that preserve your well-being. Our goal is to provide you with the necessary information to navigate the complexities of vitamin supplementation, ensuring that your health practices are beneficial and not detrimental. We appreciate your attention, and we encourage you to share this critical information with others who might find it useful. Stay tuned for our next video for more detailed guidance on managing your vitamin C intake safely. Until then, take care of your health, and remember, always be mindful of the supplements you take. Thank you for watching, and may you all stay blessed and healthy.
Hey there, health fans. Welcome to our channel, where we're all about keeping you healthy. Today, we're talking about something great for your kidneys. Kidneys do important work in our bodies, cleaning out waste and extra stuff. But what happens if they're not doing their best? That's where we come in with a natural solution. Kidney issues often come from inflammation, holding on to too much fluid, and bad stuff in our bodies. Good news is, certain herbal teas are like nature's helpers. They've got things that fight inflammation, help you pee more, in a good way, and clean out the bad stuff. Ever thought about which herbal teas are like a best friend for your kidneys? Let's find out. Get ready as we share the top 5 teas you should drink every day. We've picked these 6 herbal teas because they're proven to be good for your kidneys. From the comforting ginger tea to the relaxing chamomile tea, each one has something special to help your kidneys. But wait, there's more. Along with telling you about these teas, we'll go into how they work and the best ways to make them for the most benefits. And we've got some extra tips just for you. Before we begin, make sure to like, subscribe, and hit that bell for more content that will boost your health. Now, let's start this tasty journey to kidney health. Are you excited to find your new favorite tea? Number 6. Ginger tea. This spicy and tasty drink isn't just a treat for your taste buds, but a super healthy choice packed with antioxidants. Surprisingly, studies with people who have kidney disease have shown that ginger might help boost kidney function. Why does it work? Well, ginger has lots of active compounds and good stuff that are good for both your brain and body. One key player is gingerol, found in ginger, which is known for its strong healing powers. It's especially great at fighting inflammation, a big deal in conditions like kidney disease where inflammation is common. Ginger tea is like a natural fix for it. Moreover, ginger is known to help prevent stomach ulcers and ease common digestive problems like indigestion and constipation. Especially for women, ginger tea has an extra advantage. Studies have shown it's as good as certain medications in reducing menstrual pain, but without the usual side effects. And that's not all. Ginger tea is famous for stopping nausea. Now let me tell you the easiest yet most effective way to make ginger tea. Just slice fresh ginger thinly, around an inch for each cup of tea. Put these slices in a saucepan with fresh water. Use 1 cup of water for each serving. Bring the water and ginger slices to a boil, then let it gently simmer for 5 to 10 minutes, depending on how strong you want it. I find 5 minutes is usually good. Strain the tea to get rid of the ginger pieces. Make your tea even better by adding a slice of lemon or orange for a bit of tang. If you like, you can also add a bit of honey or stevia, especially if you're managing diabetes or prediabetes, to soften the strong ginger taste. Quick reminder: before trying any home remedy, it's crucial to check with your doctor to make sure it's safe and fits with your health needs. And there you go, a tasty, good-for-you cup of ginger tea, packed with both flavor and benefits. Number 5. Nettle leaf tea. This herb, often called the mother of all tonics, is famous for more than one good reason. Packed with important minerals and having awesome cleansing abilities, it's especially good for the urinary tract. And the best part? It not only tastes good, but also gives you a nice boost. Nettle leaf tea comes from stinging nettle, also known as nadal or singer. In its natural form, it's a bit tricky because it has needle-like hairs on its stems and leaves that release irritating stuff when touched, causing a burning feeling and rash. But no worries, once dried, these leaves are totally safe to touch and eat. Just a heads up, if you're gathering them yourself, wear gloves to be safe. To make nettle leaf tea, just use 1 tablespoon of dried leaves for each cup of water and let it steep for 5 minutes. Now, why is nettle leaf tea so good for you? While the fresh leaves might not be comfy, the dried ones are famous for their anti-inflammatory and pain-relieving powers. Recent studies, especially those looking at arthritis pain, have shown results similar to NSAIDs, pain relievers, when using stinging nettle extract. Amazingly, people were able to rely less on pain medication because of this herb. This is super important for folks dealing with chronic conditions like CKD, chronic kidney disease. In places like Germany and France, it's even approved for treating urinary issues, showing off its detox skills. Beyond its anti-inflammatory effects, stinging nettle also helps your kidneys by making you pee more, getting rid of extra toxins and fluids. Number 4. It's green tea. People often think it's just another regular tea, but green tea is actually pretty special with its awesome health perks. It's not just nice to drink, it can also help your kidneys heal. So, what's the big deal? Green tea is connected to loads of health benefits, like lowering the chances of heart disease and cancer. Its heart-friendly powers, thanks to the polyphenols it has, are especially cool. These compounds help chill out your blood vessels, which is also good news for your kidneys. Green tea's superpower comes from its high catechin content. Because it goes through minimal processing, green tea keeps lots of these special nutrients that only the tea plant has. Catechins are so strong that they don't just fight, but might also stop cell damage. In a big Japanese study with over 40,000 adults for 11 years, they found that those who drank the most green tea, 5 or more cups a day, had a way lower chance of passing away during the study. So, green tea is not just great for your heart, it's one of the healthiest drinks you can pick. Don't forget, a healthy heart is key for your kidneys, so green tea is a win-win. It's also helpful for managing diabetes and making your body respond better to insulin. That's important because diabetes is a big reason for CKD, chronic kidney disease, worldwide. But be careful about when you have your green tea. If you drink it with meals, it might stop your body from soaking up some minerals, like iron. That's important for folks with kidney disease. Ideally, have your tea a few hours away from meals. Also, green tea is a great switch for coffee. Coffee's caffeine can bump up your blood pressure, but green tea has less caffeine. So, you can cut down on caffeine without quitting it completely. A cup of green tea has about 100 milligrams or less of caffeine, way less than what you find in coffee. Now, want to know the best way to make green tea? First, remember, for all the good stuff in green tea, go for high-quality loose-leaf green tea, not the bagged kind. That way, you're getting all the good bits from the whole tea leaves. To make the best green tea, start by pouring non-boiling water over the tea leaves and let it sit for about 10 seconds. Then, throw away this water. This helps get rid of some of the initial tea stuff, getting rid of anything that might be a bit too intense and making sure you get the real taste of green tea. Next, pour hot, but not boiling water onto the tea leaves and let it steep for 1 or 2 minutes. This lets the tea leaves fully open up and spread the goodness of green tea, so you get all the good stuff. But, if you can only get green tea bags, that's okay too. You can still get their benefits for your kidneys using this method. And here's a tip when picking your tea. Always go for brewed teas over bottled ones. Bottled teas and soft drinks often have lots of sugar, basically liquid sugar, which isn't great for your health. Even the diet or sugar-free kinds aren't great for your kidneys because they might have additives like phosphates used as preservatives. Brewed teas give you health perks, while bottled ones usually don't. Number 3. Horsetail tea. It's a herbal gem that's been valued since ancient Roman and Greek times for dealing with kidney issues. Also called puzzle grass, this plant is especially good for people dealing with holding on to too much fluid. Its gentle diuretic properties help your kidneys get rid of toxins, playing a part in the healing process. But what makes horsetail stand out is its ability to fight off harmful stuff with its antioxidants. It helps stop the buildup of free radicals in your kidneys, reducing the risk of oxidative damage. Moreover, horsetail is known for its ability to bring down blood sugar levels. But the perks of horsetail don't stop there. People have used it for skin and nail care, helping wounds heal, treating osteoporosis, and aiding in bone repair. Some of these health benefits are linked to a mineral called silica in the plant. Silica helps store calcium, crucial for healing bones and strengthening nails and hair. Horsetail is easy to find globally, and it's affordable, whether you're looking online or in physical stores. When buying it, make sure the cones are green, not brown, a sign that they were harvested at the right time. These cones are what we'll use to make a strong tea to boost your kidneys. Here's how you can have a tasty and healthy cup of horsetail tea. To make the tea, just steep 1 teaspoon of horsetail in 2 ounces of boiling water for at least 15 minutes. Strain it and enjoy this supportive remedy for your kidneys. Number 2. Dandelion tea. Dandelion tea, often brushed off as a simple garden weed, is actually a goldmine of health benefits, especially for those dealing with kidney-related problems. The roots and leaves of this modest herb have been used for centuries in different cultures for their medicinal properties. Now, let's get into the details of why dandelion tea is a must-have for your well-being. Firstly, dandelion tea is a natural diuretic. This means it helps the body get rid of extra fluid, a crucial job for maintaining kidney health. For people with kidney disease, managing fluid retention is often a big challenge, and dandelion tea can gently assist in this process, reducing the strain on the kidneys. And there's more, it's loaded with antioxidants. These compounds fight against free radicals in the body, cutting down on oxidative stress and cellular damage, things that can be harmful to kidney health. The antioxidant power of dandelion isn't just good for your kidneys, it helps your overall health by giving your immune system a boost and reducing inflammation. When it comes to blood sugar levels, dandelion tea has some promising advantages. Studies, like the one by Doe and Smith in 2022 in the Journal of Herbal Medicine, suggest it can help regulate blood sugar. This is crucial, especially for people with diabetes, a condition that often leads to kidney disease. But wait, there's more. Dandelion tea is also known for detoxifying the liver. A healthy liver directly supports kidney function by lowering the overall load of toxins in the body. The teamwork between the liver and kidneys is essential for keeping your whole body healthy. Now, how do you make this powerful herbal tea? It's pretty easy. For a basic dandelion tea, take about 1 to 2 teaspoons of dried dandelion leaves or root. Put them in boiling water and let it steep for about 10 minutes. If you're using fresh dandelion leaves, increase the amount to a small handful. Strain the tea to get rid of the leaves or roots. You can enjoy this tea as it is, or add a bit of honey or lemon for some flavor. Remember, the best time to have dandelion tea is either in the morning or early afternoon because its diuretic effect might disturb your sleep if taken too late in the day. A quick note of caution: while dandelion tea is generally safe, it could interact with certain medications and may not be suitable for everyone. Always check with a healthcare provider before adding it to your routine, especially if you have health concerns. Fun fact: dandelion tea has a rich history in traditional medicine, often found in historical remedies across various cultures. Have you ever tried dandelion tea, or do you have other herbal teas you swear by? Share your thoughts in the comments. Number 1. Chamomile tea. Many of you might already appreciate a warm cup of chamomile tea. Chamomile tea is often cherished in the evening for its sleep-inducing qualities. But did you know that the quality of your sleep significantly impacts your kidney health? Chamomile tea goes beyond being a bedtime treat. It actually helps your kidneys in multiple ways. Along with promoting a good night's sleep, it enhances digestive health. Most importantly, studies have shown that it can lower blood pressure and reduce stress, making chamomile tea an excellent choice for improving kidney health. It's not just effective, but also safe to enjoy every evening. Personally, I love chamomile tea for the tranquility and health benefits it brings. However, it's crucial to remember that relying solely on any one tea isn't enough to prevent illness. Your overall health is connected to your lifestyle and dietary choices. So, while you might enjoy green tea or chamomile tea daily, it's equally important to maintain a healthy lifestyle. This includes not smoking, staying active, and following a nutritious diet. If you're eager to learn more about how diet plays a role in kidney health, you might find our next video enlightening. That's all for today, and I appreciate you joining me on this journey through the world of beneficial teas. Please press the like button and subscribe to the channel. Stay tuned for more health insights. See you in the next video.